Obstetrics and gynecology is the medical specialty dealing with fields of obstetrics and gynecology through only one postgraduate training program. This combined training prepares the practicing OBGYN to be adept at the care of female reproductive organs' health and at the management of obstetric complications, even through surgery. Training. The training required to practice medicine as an OBGYN is extensive, although the exact duration of training varies by country. In the United Kingdom, training lasts 7 years. In the United States, 4 years in residency are required for MDs and DOs. In Australia, the residency training period is 6 years, matched only by neurosurgery and maxillofacial surgery. In India, postgraduate training in obstetrics and gynecology is in the form of a 2-year diploma course or a 3-year. Some OBGYN surgeons elect to do further subspecialty training in programs known as fellowships after completing their residency training, although the majority choose to enter private or academic practice as general OBGYNs. Fellowship training can range from 1 to 4 years in duration, and usually have a research component involved with the clinical and operative training. All gynecologists are trained obstetricians, although the reverse is not necessarily true. However, some OBGYNs may choose to drop the obstetric component of their practice and focus solely on gynecology, especially as they get older. This decision is often based on the double burden of very late hours and, depending on the country, high rates of litigation. This combined training prepares the practicing OBGYN to be adept at the surgical management of the entire scope of clinical pathology involving female reproductive organs, and to provide care for both pregnant and non-pregnant patient. A bachelor's degree is the minimum formal education required. Subspecialties. Examples of subspecialty training available to physicians in the U.S. are maternal fetal medicine, a uro and obstetrical subspecialty, sometimes referred to as perinatology, that focuses on the medical and surgical management of high-risk pregnancies and surgery on the fetus with the goal of reducing morbidity and mortality. Reproductive endocrinology and infertility, a uro, a subspecialty that focuses on the biological causes and interventional treatment of infertility. Gynecological oncology, a uro, a gynecologic subspecialty focusing on the medical and surgical treatment of women with cancers of the reproductive organs. Female pelvic medicine and reconstructive surgery, a uro, a gynecologic subspecialty focusing on the diagnosis and surgical treatment of women with urinary incontinence and prolapse of the pelvic organs. Sometimes referred to by laypersons as female urology, advanced laparoscopic surgery, family planning, a uro, a gynecologic subspecialty offering training in contraception and pregnancy termination, pediatric and adolescent gynecology, menopausal and geriatric gynecology. Of these, only the first 4 are truly recognized subspecialties by the Accreditation Council for Graduate Medical Education and the American Board of Obstetrics and Gynecology. The other subspecialties are recognized as informal concentrations of practice. To be recognized as a board-certified subspecialist by the American Board of Obstetrics and Gynecology or the American Osteopathic Board of Obstetrics and Gynecology, a practitioner must have completed an ACGME or AOA accredited residency and obtained a certificate of added qualifications which requires an additional standardized examination. Additionally, physicians of other specialties may become trained in advanced life support in obstetrics, a short certification that equips them to better manage emergent OBGYN situations. Recent shortage in U.S., from 2000 through 2004, American medical students were increasingly choosing not to specialize in obstetrics. This led to a critical shortage of obstetricians in some states and often fewer healthcare options for women, a uro, although it did not lead to higher average salaries. However, beginning in 2004, increasing state legislation mandating tort reform combined with the ACGME's decision to limit resident work hours led to a gradual resurgence in the number of medical students choosing OBGYN as a specialty. In the medical residency match for 2007, only 6 spots in OBGYN training programs remained vacant throughout the entire United States. A record low number, and one that puts OBGYN on par in terms of competitiveness with some other surgical specialties. Salary. The salary of an obstetrician varies by country. In the United States, the salary ranges from $200,000 to $339,738. See also, theriogenology, andrology, urology, notes and references. Bibliography, Llewellyn-Jones, Derek, Fundamentals of Obstetrics and Gynecology, 7th ed., Mosby, 1999. External links: 1. International Federation of Gynecology and Obstetrics, BJOG, an international journal of obstetricians and gynecologists, World Congress on Controversies in Obstetrics, Gynecology and Infertility.